You know that feeling, right? That first little scratchy sign in your throat that something's coming? Well, before you reach for just anything, you should know that in the world of pharmacy, we have specific tools for that job. They're called monophasic oral liquids. Today, we're going to break down the big three: gargles, mouthwashes, and the one you might not know about, throat paints. Let's get into what they are, what's in them, and how they actually work.
So, here's what we're going to cover. First, we'll dive into gargles, which are all about tackling throat infections. Then, we'll talk about mouthwashes, which are more for your everyday oral hygiene. After that, we'll look at the really interesting and specialized throat paints. And to wrap it all up, we'll do a quick side-by-side comparison to make sure it all sticks.
All right, first up, let's talk about the one designed to fight that sore throat head-on, the gargle.
So what is a gargle, really? Well, it's a water-based or aqueous solution that has one clear mission: to prevent or treat infections right there in the throat. Its main job is therapeutic. It's there to soothe that soreness and fight off whatever's causing the problem in the first place.
Okay, now for all you future pharmacists watching this, listen up because this is super important. Gargles almost always come in a concentrated form. That means you have to dilute them, usually with warm water, before you use them. This is a critical safety instruction to make sure the solution is too strong and works exactly as it's supposed to.
So what's the magic that makes a gargle work? It's all in the ingredients. First, you've got antibacterial agents like phenol and thymol to actually fight the infection. What's cool is that these can also act as mild anesthetics to kind of numb the pain. Then you might have astringents like potassium chloride, which help to gently tighten the tissues back there, giving you that soothing feeling.
And check this out. This is how a classic formula is made. It's actually pretty straightforward. To make a phenol gargle, you'd start with a coloring agent, mix it with a little water, then you add your active ingredient, the phenylglycerin. Give it a good stir until it's all mixed together, and then just top it off with purified water to get to the right volume. Simple, right? A total pharmacy staple.
Okay, so we've covered the medicine for when you're sick. Now let's switch gears and talk about daily maintenance, keeping your mouth healthy with mouthwashes. Now, a mouthwash has a totally different job than a gargle. Its main purpose isn't really to treat an infection. It's all about maintaining good oral hygiene. The key words here are clean and deodorize. It's designed to give you that fresh breath feeling and just keep your entire mouth, your whole oral cavity, feeling fresh. This slide really lays it all out. A gargle is like a targeted medicine you've only used when you have a sore throat. But a mouthwash, that's more like your daily routine for overall hygiene. And it usually comes ready to go, right off the shelf. No dilution needed.
And you can see that difference in the ingredients. A mouthwash often has alcohol, which acts as a solvent and an antiseptic. You've got glycerin to give it a bit of texture, sweeteners and flavors to make it taste good, and surfactants, which are basically like tiny soaps that help clean everything out.
All right, now for our third and, honestly, most interesting category. We're not swishing or gargling anymore. We're talking about direct application with throat paints. And the one word you have to remember here is viscous. So a throat paint is exactly what it sounds like, a thick, viscous liquid that you literally paint onto an infected spot in your mouth or throat. This is not a rinse. This is a targeted treatment for a specific, localized infection.
So why is it so thick and sticky? The secret is right here. The glycerin base is key because it's viscous, which means it clings to the mucous membrane. It sticks around for a long time. That prolonged contact is what allows the medicine to really do its job effectively. That's its superpower.
So let's just quickly recap what makes throat paints so unique. You apply them directly with a soft brush. That glycerin base not only makes it stick, but also gives it a naturally sweet taste. The whole point is for that prolonged action of the medicine. And a classic example you'll definitely come across is compound iodine paint, which also goes by the name Mandel's paint.
Okay, we've broken down all three types. Now, let's put everything side by side so you can really see the differences and lock this information in.
This table right here is your ultimate cheat sheet. So gargles, they're for throat infections, they're concentrated, and they're water-based. Mouthwashes, they're for hygiene, they're ready to use, and also water-based. And throat paints, they're for localized infections. Their key feature is that they're viscous and adhere, all thanks to that glycerin base. If you can remember these key points, you've got this down.
So, let's end with a question for you, the next generation of pharmacists. We've just talked about these classic, time-tested formulas. But how can we make them better? How can modern pharmaceutics improve how these drugs are delivered, or how they taste, to make them even more effective for patients? That's something for you to think about as you move forward. Thanks for joining me.